Couch Convo with Coach Karla. I am your host, Karla Lewis, and this is where current events and mental health converge. Welcome. Thank you so much for joining us on tonight. Tonight we have very special guests with us. We have Michelle Seymour. She's been with us on the show before. She is a men's health ambassador with the Cutting Out Stigma program. We'll talk a little bit more about Michelle, but we also have Dr. Ima Ahonkai.
Perfect.
I got it right. Yay, me. She is I'm going to say that she is a world renowned HIV awareness expert and researcher. She is an infectious diseases physician and health equity expert with extensive expertise in HIV medicine, public health, epidemiology, and implementation research. She earned her undergraduate degree from Harvard University, completing medical school and residency at Johns Hopkins Hospital, and obtained a Master of Public Health from the Johns Hopkins Bloomberg School of Public Health. Welcome.
Thank you.
Yay.
Thank you.
I'm so happy to have both of you. And we wanted to talk about this particular subject. Well, I wanted to talk about this subject because we have the second highest growing rate of HIV right here in Memphis, Tennessee. And Dr. Ahonkai can correct me if I'm incorrect, but it's a big issue. And I'm really glad that to see a grassroots effort being put forth to address it. The Cutting Out Stigma program is a program that trains barbers in different communities to talk about HIV awareness and health. And so it's just something that's really exciting to me. And we're going to get started with some questions. But first, I just want to know from Dr. Ahanka, what made you interested in starting this program?
Sure. First of all, I'm so happy to be here, and thanks for having Michelle and I on this evening.
Yes.
But yeah, the origin story of this, as you mentioned, I'm an infectious diseases physician, and I was seeing patients in the hospital at Vanderbilt
Mm-hmm.
in Nashville. And the first few times I was in the hospital, I saw young Black men who
Mm-hmm.
came into the hospital with advanced HIV
Mm.
because because they didn't present on time. So they were really sick when they came to the hospital,
Okay.
and so sick that they ended up going on hospice.
Mm.
And it really shook me because this is an infection that's preventable and
Mm-hmm.
it's treatable. And it was a manifestation of all of the challenges that we have
Mm-hmm.
magnified in our communities, in
Right.
African American communities. And I really wanted to be able to do something about that. So it came from what I was seeing as a physician,
Mm-hmm.
but then also wearing a hat as a researcher and thinking, how can we work together with our communities to find a solution?
Mm-hmm.
So that's where it kind of started.
Okay.
Yeah.
And so I know that you selected barbershops. What makes barbershops particularly impactful in terms of getting this particular message out?
Definitely. So, we did some research around this topic,
Mm-hmm.
and part of the reason that we were seeing people present so late to care,
Mm-hmm.
a number of reasons for that. But we worked with the health department to the Tennessee Department of Health
Mm-hmm.
to understand like who wasn't getting into care and try to see which populations we could try to address. And that
Mm-hmm.
led us to okay, Black men are not getting into care. They're
Right.
a population we really have to focus on. But then we said, of course, where do Black men go? They're not
Mm-hmm.
coming to the health system.
Mm-hmm.
So we got together with a community of barbers and said, this is the problem we're seeing. How can we partner together to address it?
Mm-hmm.
But in those initial conversations, we kept hearing stories about HIV stigma. So we were
Mm.
hearing things like, I'd rather get shot than say I had AIDS. I don't even want to hear the word AIDS.
Wow.
If I got that diagnosis, I would kill myself. So this is like
Mm.
the level of stigma we were hearing. And so
Mm.
we said, okay, how can we work together to address the stigma?
Mm-hmm.
And so this was really an idea that came from partnering with researchers, on the academic side, with
Mm-hmm.
organizations, Streetworks in Nashville
Mm-hmm.
is our initial community partner, and then
Okay.
partnering with barbers in Memphis and in Nashville.
Okay.
Yeah.
And so are Memphis and Nashville the only cities where this program has been initiated so far?
So far, we are the pilot test case.
Okay.
And I think we're doing, and Michelle and all the cohort of barbers are doing an amazing job. So we plan to go much farther than this, but
Okay.
this is where we've started. Yeah.
Okay. So let me switch to Michelle. Hey, how you doing? Now I see this young lady all the time because she does my hair. And you all have seen her work on the cover of the magazine that I was on, Bluff City Magazine, and because she does makeup as well. She didn't do my makeup tonight, but she does makeup as well. So I wanted to make sure that I threw that in there. But she's the owner of Risque Hair. And she is, as I mentioned before, a men's health ambassador, and she's been a licensed cosmetologist for 9 years.
Yes.
Okay. So, I wanted to know how did you find out about the Cutting Out Stigma program?
Well, I was working one day and two representatives, shout out to Steve and Nate, walked into the shop recruiting.
Oh, okay.
And so there initially was a training seminar that we went to.
Okay.
And from there, I guess they decided who would be good to work with and who actually wanted to move further in the program.
Mm-hmm.
And I was moved because, like she said, our black men don't always get the attention that they need,
Mm-hmm.
not in the ways that are most necessary.
Okay.
And so I stuck with it. I hung in there.
Okay. So, what's the program been like for you so far?
It's good to see a community where involving black men
Mm-hmm.
because most of the my counterparts are black men who are
Mm-hmm.
barbers. So it was good to see black men who are actually interested and invested in trying to help others
Yeah.
and push the message.
Okay. Are you the only woman in the program?
I'm not. I'm alongside Corey,
Okay.
who also works with me in Crazy About Here.
Okay, good, 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 good. Is there anything else you can? Well, no, actually, tell me what your role is as a men's health ambassador with cutting out stigma.
Okay. So, my role, my duties pretty much are posting using media to pass the message,
Mm-hmm.
to catch the attention of, people in the local area, to speak with my clients on a daily basis,
Mm-hmm.
spread, HIV statistics, give them resources on where they can get help,
Mm-hmm.
inform them of treatments
Mm-hmm.
and preventative measures,
Mm-hmm.
and pretty much make them comfortable with speaking on some uncomfortable subjects.
Okay, that sounds good. All right. All right. So Dr. Ima, actually, what do you want me to call you? Dr. Ahunke or Dr. Ima? How do you want me to address
Either
you?
one is fine. Some of my patients have trouble saying my last name. So
Uh-huh.
Dr. Ima, I've gotten used to hearing that quite a bit. So either one is okay.
Let me say Dr. Ima, okay? All right. So, could you tell us now you told us about the inspiration for the program and we talked about why barbershops are effective. Can you tell me a little bit about how this program addresses the cultural and social dynamics that contribute to the stigma of HIV?
Yeah, I do. I want to go back for a minute just to say why barbers are so special.
Okay.
And I don't think I emphasize that enough. One of the things that I say in academic settings where I'm giving this presentation is that as a physician, I see my patients maybe a few times a year.
Mm-hmm.
And you can attest, Michelle, I mean, your clients you may see once a week, twice a month, multiple times, right? So
Right.
there's so many more touch points for this relationship, this trusted relationship.
Mm-hmm.
And we all have that experience of going to our beautician or barber and you're relaxed and you share all kinds of stuff. So it's a trusted it's a safe space.
Mm-hmm.
And we needed to figure out where there were safe spaces that Black men felt comfortable talking and sharing and learning.
Right.
And so that's really why we went. And we know the origins even of barbering goes back to medicine and
Mm-hmm.
surgery. So there are lots of roots and ties. It's kind of full circle.
Okay.
So that's really why we wanted to partner with barbers. And then as you mentioned, doing this in Tennessee, like Tennessee is an important region because HIV is more prevalent in the southern United States. But then
Mm-hmm.
as you mentioned in Memphis, Memphis has really high rates of HIV, second
Mm-hmm.
highest of any other metropolitan area in the country.
Mm-hmm.
So it's a really important area for us to do this work.
Okay.
But the intervention itself, as Michelle was describing, we have a couple of components because when we first started talking with barbers, they said, okay, we're willing to do this, we're willing to have these conversations, but we have to one get trained so we
Mm-hmm.
know what we're talking about,
Yeah.
and we have to have something that sparks conversation
Mm-hmm.
because this is a stigmatizing topic.
Mm-hmm.
People aren't just going to talk about it naturally.
Yeah.
So what is going to encourage the conversation to come up?
Okay.
So we thought about having print media. So there's some posters up in the barbershops. We'll be putting up billboards pretty soon
Mm-hmm.
in Memphis and in Nashville. And then the social media content that Michelle mentioned. So we have a social media calendar where the barbers are posting each week.
Okay.
And that's also a way to spark conversation. So
Mm-hmm.
really trying to blanket some media around the community that's
Mm-hmm.
really encouraging conversation in a different way that
Mm-hmm.
the barbers can now facilitate. And then, of course, as Michelle mentioned, really referring people to resources.
Yeah.
So they learned about in the training both HIV prevention and testing resources, but also resources regarding mental health,
Mm-hmm.
resources regarding financial planning. How do you
Good.
even get health insurance if you don't have it? So,
Mm-hmm.
so the vendors that came to the resource fair that was at the end of the training, the barbers participated in,
Mm-hmm.
were hitting on a number of different areas that we thought were important, and we heard from the barbers would be important to include.
That's good
Yeah.
because one of the things that I know is a lot of black men do not go to the doctor, period.
Yes.
Okay. And I mean that it can be young or older
Yes.
because I've been surprised about the number of young black men who
Mm-hmm.
don't like presenting to the doctor.
Yes.
And I'm not sure why, but Dr. Ima, do you have any idea why they're so, and I'm not even sure if afraid is the answer, but why they're so afraid about going to the doctor?
I have one of my colleagues at Vanderbilt, Dr. Consuelo Wilkins, said this really nicely because we talk a lot about trust in the healthcare system.
Mm-hmm,
And we
mm-hmm,
know that this is really a challenge for especially minority communities because of really important legacy
mm-hmm.
of distrustful things that were done, by the healthcare community. And the comment that I've heard her make a few times that I really love is that we as a healthcare system have to work to make our systems more trustworthy. We
Mm-hmm.
can't expect people to just now trust us. Like, what
Mm-hmm.
are we actually doing?
Right.
So I think that's one important reason is
Mm-hmm.
healthcare mistrust. We
Mm-hmm.
talked to some of the barbers about this actually when we were doing our initial work, and it's it's trust. It's how are you treated when you get into the hospital?
Mm-hmm.
Is your voice heard? Are you respected? And and when you have those layering negative experiences,
Yeah.
then why are you going to come back?
Right.
One of the quotes we heard from the barbers, and I think we all, any of us who have black men in our families in our circles,
Mm-hmm.
that we don't go until we're damn near dead. That was kind of the quote.
Unfortunately.
And I think
Yeah.
that's an all too common experience. But what we're hoping to do is really normalize some of these conversations around health in general as well.
Okay. You mentioned there's going to be a launching of a multimedia campaign as a part of the initiative, and that's going to include digital media, billboards, and community-based outreach. How will all of these different things help amplify the message and reduce the stigma surrounding HIV?
I think you've heard, and I'm sure, Michelle has experienced this too. I mean, it's very difficult to just launch into these conversations, right? We,
Mm-hmm.
Yeah.
it's kind of a no-go area. I mean, when we were talking to some of the barbers in the beginning, it was like, oh yeah, we talk about everything. We talk about everything in the shop. We talk about sex, but oh no, we don't talk about that. We do not talk about
Right.
HIV, and we do not talk about sexually transmitted infections. Like
Yeah.
what?
Yeah.
So
The icky
we
parts.
the icky
Yeah.
parts,
Yeah.
exactly. So we had to find a way to start to make the conversations a little easier to have. So we started with some of the social media posts is talking about health, just talking about health,
Mm-hmm. Mm-hmm.
talking about community, talking about caring for each other and ourselves, talking about your physical health, your mental health being all part of your health, and then your sexual health is part of that, and then kind of easing our way into this conversation. And I really respect the work that all of the health ambassadors have been doing, because they've had to find their comfort zones and how to enter into these conversations.
Yeah.
I think they've done a great job of negotiating that comfort with themselves, with their clients. And I think starting to hear that over time, those conversations are getting a little bit easier.
Okay. So, Michelle, how has it been for you to try to initiate those conversations with clients? What has it been like?
Honestly, it's been pretty smooth so far. Most of my clients know I'm pretty open. I share a lot about myself, and I give you all the floor to share a lot with me. And so it was pretty smooth. There was one hang up though. It's like I boasted too soon. There was a post where we share, a photo of our client or of our work with the client, and leave a message with that, leading with, our work, and gave us some creative freedom. And I only have like a handful of male clients. And there was one in particular who I felt like I was closest with. I take care of him, I take care of his wife, I take care of their daughter. So I felt like, okay, we're pretty close. Maybe this would be the client to address with that.
Okay.
And he was like, do not host me with any message about HIV. Like, I understand what you're doing, it's
Ooh,
appreciated. However, I'm not sure I want to be associated with it. And I'm like, well, it
yeah.
doesn't necessarily have to be your face. But other than that, speaking about it, talking about, the resources, the statistics, spreading the message, and what makes us so afraid to, approach the conversation has been smooth. Actually talking to people, people seem pretty open about it, and I think it's because of the warmth of my chair.
Okay. All right. That's good. That's good. Yeah, your chair is warm. Okay. Yes. So, yeah, I hear a lot of conversation at the beauty shop. So that's what I mean by that. I want to make sure
Yes,
people understand.
yes. It's a
Okay.
family environment. We all share each other.
Okay. So, as a physician and health equity researcher, Dr. Ima, what is your vision for achieving greater health equity in Tennessee, especially in Black communities, through programs like this?
For me, this program is a perfect example of the power of community coming together to do something for community. I think that in public health, a lot of times we've taxed the community with, we need you to do this, we need you to do that, but not either providing the infrastructure to develop a sustainable model. And so I am, one, committed to saying that, look, if this way isn't working, if having Black men come to the hospital is not working, while we work on making the hospitals more of a welcoming environment, a trustworthy environment, then we have to also build up other infrastructure. And that for me looks like this. It means like having a community of trained health ambassadors who are in the barbershop where people are going. So I think that there's so much power to this type of model, if we can really do it in a way that's sustainable. And I'm really excited about those opportunities.
Yeah. How will you measure the success of the program, Cutting Out Stigma?
So, well, I don't know if I did describe. So, this is a pilot. It's a 6-month pilot where we're really just testing the concept, saying, is this something that's acceptable to barbers? Will they sign up and do it? If we post, how far can we kind of spread this message using these multimedia methods? So, we're measuring what's the amplification, what's the reach of the posts. We've also surveyed some patrons in the barbershops to understand what's stigma like, and the barbers, what's stigma like before we start, what is it like at the end. So this is it's a demonstration and implementation project, but it's also a research study,
Okay.
because we want to make sure that we're doing something in a way that's effective.
Okay.
So with that information, then we will go and do this in a much bigger way across multiple cities. That's the plan.
Okay. Well, that,
Yes.
that was going to be my next question. If it's successful, how will you scale it to other cities or communities beyond Nashville and Memphis?
Well, I think that we initially had, we shouted out Nate and Steve earlier, who
Yes.
are on our team, on our research team actually, and they are two barbers based in Nashville, a
Oh, okay.
distinguished gentleman and at Luxury Mobile Barbering,
Mhm.
and then our partners at Streetworks in Nashville
Mm-hmm.
as well, led by Ms. Sharon Hurt. So I think this model shows us that we can have a train the trainer type model.
Mm-hmm.
You know, Nate and Steve were part of the original team and they helped us recruit and train barbers in Memphis and Nashville. And as we expand to other cities, we can utilize the barbers that have already been trained to help us
Mm-hmm.
expand to more cities.
Mhm.
So that's the path that I hope we can take.
That
And social
sounds
media,
good.
of course, makes that all possible. And all the national networks of barbers and beauticians can really help us to spread in an organic way.
Okay.
Yeah.
Do you have advice for other cities that are grappling with the same issue, like how they could tackle HIV awareness?
I think it's partnering with community and listening to what you're hearing is really important.
Mm-hmm.
A lot of times we say, okay, this model worked here, we'll copy and paste and do the exact same thing
Mhm.
here. Even moving from Nashville to Memphis, folks were like, look, Memphis is not the same as Nashville. You're gonna have to do the Memphis shuffle and figure out, make sure it's working here, make sure people are accepting it. So
Mm-hmm.
those are the types of things that are important to make sure that even if you have an overall model that works, that
Mm-hmm.
you're talking to community members and partnering with them to say, okay, we may need to adapt this part because
Mhm.
that's not going to work in this community.
Mm-hmm.
Mhm.
So it's being really mindful, listening to the community, adapting elements to make sure it's really relevant
Mm-hmm.
for the kind of nuances of different cities and communities.
Okay.
So I think overall the model may still work, but it still has to be adapted.
Okay.
Yeah.
Now, is there any cross communication between the Nashville barbers and the Memphis barbers to like share information, how the program is going, things like that?
Definitely. Do you want to answer that, Michelle?
Oh, sure. Well, for one, we communicate weekly on Mondays. We have a Zoom meeting
Okay.
and we share the things that have went well with us for, our communication with the clients. And we share some things that might have been hangups.
Mm.
And we as a group, just piggyback off of each other's information and experiences.
Okay. Michelle, how do you feel like the program has helped you grow as a person?
Tackling tough conversations for sure.
Mm-hmm.
Um, it's all fun and games. I love to keep it light. I love to laugh and giggle, but things that are tough, I tend to avoid, and that's just in life, period.
Yeah.
So being able to practice speaking about things that may not be as comfortable, starting with my clients
Mm-hmm.
whom I'm close to, but it's a little, it's still light. It's still not as deep because you have the room to cut it off
Mm-hmm.
or to move to the next subject, and then there are other people that we can interact with as well.
Mm-hmm.
It's given me the practice to do those things personally as well, so I'm very appreciative of being able to partner in this program.
What do your babies think about you being in the program? Michelle has you have two girls, right?
Yes.
Okay, what do the babies think about you being in the program?
Gia and Mira are so advanced in their thinking. I would be actually honestly afraid to bring this to them because my little one, she's not the typical why asker.
Mm-hmm.
Her why isn't just why.
Mm.
Her why is detailed.
Oh, okay.
And it's one of those, if you know, you know.
Yeah, yeah.
But one day, eventually, I will definitely be pushing them to use those voices and ask those questions and get involved in some things that other people might consider touchy.
Okay. All right. Sounds good. So, Dr. Ima, you're a physician and a health equity advocate. What motivates you in your work and what keeps you going in the fight against HIV stigma?
Taking care of people living with HIV and really understanding firsthand how crippling the
Mm,
stigma is for people.
okay.
I've taken care of many patients who, they come into clinic and they seem okay on the surface, and it's like one question
Mm-hmm.
that just kind of breaks everything down.
Mm-hmm.
People who, have been living with HIV for years and just telling the story of how they got infected just brings them to their knees again.
Mm-hmm.
It's a real, it can be really crippling. And I think that that's really what's motivated me. One, the fact that because we have such excellent treatment and prevention options,
Mm-hmm.
we truly could eliminate HIV
Mm-hmm.
if we could get these resources to everyone who needs them.
Mm-hmm.
We can prevent it and we can
Mm-hmm.
treat it. So why is it still here? And
Yes.
why, when people get this disease that is treatable, that they can live a long, healthy life with, do they go underground because they're so ashamed and afraid? It really, I have the compassion for people living with HIV, but I also, just as a minority physician, the number of inequities that we have in health for across every chronic disease you can think of,
Mm-hmm.
it's not something that I want to see continue. It's something that I feel really compelled to play my part in addressing.
Okay.
So those are the things that motivate me.
As you were talking, I was thinking about what this means. So this means that people are more concerned about what people think than they are about their own health.
Mm-hmm.
Well, one of the sessions that we had in the training with the barbers is was called "How Stigma Causes Sickness."
Mm.
And it's this vicious cycle because stigma can be, what I think you think about me.
Mm-hmm.
It can be what I think about myself because
Mm-hmm.
what society is saying I should think about myself because I have this disease.
Mm-hmm.
And yes, that vicious cycle can really keep people out of the healthcare system. They don't want to be seen in an HIV clinic. They don't want anyone to know that they have this diagnosis. I've seen patients travel from Memphis to Nashville to get their care because they don't want anyone in Memphis to know that they have HIV.
Mm-hmm.
So it really does powerfully impact people's behaviors. Yeah, even in the overlap with mental health,
Mm-hmm.
because of course, if someone is really suffering from depression or really severe distress because of their diagnosis, that can really deactivate someone from being able to take the steps to go and see a doctor, take medicine, all of the steps that they have to take.
Okay.
Yeah.
Now, do people understand more about HIV now today than they did, I guess, 15, 20 years ago? And does that help eliminate some of the stigma?
It's interesting. I think that we certainly have come a long way,
Mm-hmm.
right? We
Right.
are at a place now where, like I said, you can prevent HIV, you can treat HIV with one pill once a day, you can live a totally
Mm.
normal life.
Yeah.
But even for me today, if I diagnose someone with HIV, all I say in the first meeting is that you're going to be okay,
Mm.
because people still think they're going to die.
Mm.
And I think even though there's a lot of knowledge improvement, there's still this visceral fear that comes out.
Mm-hmm.
I don't think people know widely about prevention.
Mm-hmm.
I don't think people know widely about the fact that you can live a totally normal life with HIV. That for me as a physician, it's easier for me to treat your HIV than your diabetes. You
Mm.
know,
Mm.
and so
Yeah.
I don't think there's a general understanding of that. And there's still, a lot of questions about, is this even still a thing?
Mm-hmm.
Magic Johnson had it. Does people still even have it now? So
Right.
there's a lot of myths and misconceptions still kind of brewing.
And
Yeah,
so people talk amongst themselves as opposed to getting the information from the horse's mouth or from the right source, so to
exactly.
speak.
Exactly.
Okay. All right. Well, this is a very interesting conversation. I did want to let you know that I have some Nashville ties because I attended Fisk University.
Yes, I saw
Yes.
that.
You did?
Yeah.
Oh, that's right. Okay. All right. Okay. She checked out my LinkedIn
I
profile.
did. I
Okay.
did.
So, yay, Fisk. All right. So, I've really enjoyed our conversation. I feel like I'm learning a lot, but I'm as a mental health therapist, I'm very excited to see the involvement with the community.
Yes.
Because I think that's going to be very impactful in terms of helping people feel more comfortable, and
Mhm.
that's been a big part of what I do as a
Mhm.
therapist is wanting people to feel like mental health is well, taking the stigma out of mental health. Yeah.
Exactly.
So that people feel comfortable reaching out for care. And most certainly, one of the first things that I say to people in my sessions also is, you're going to be okay. So we're going to go to commercial break. And when we come back, we're going to continue our discussion on cutting out stigma and HIV awareness and prevention.
Hello, I'm attorney Misty L. O'Neill. It has been a privilege and an honor working alongside my father at the law office of Daryl J. O'Neill and Associates. Here at the law office of Daryl J. O'Neill and Associates, attorney Daryl O'Neill is an experienced attorney who has laid years of foundational work to help build his community. At the law office of Daryl J. O'Neill and Associates, we strive to bring excellence to you through hands-on experience, quality care, and hard work. Our main focus is medical malpractice, Social Security disability, employment discrimination, personal injury, automobile accidents, workers' compensation, wills, and contracts.
Hi, I'm Daryl O'Neill, and I'm working for you.
Ladies, do you feel feminine during your feminine flow? You know, your monthly cycle, your period? Are you still suffering in silence? The suffering is over. It's time to choose Rain. Rain is an all-natural, premium sanitary napkin with 8 layers of cotton, high-grade polymers, graphene to help cut bacteria by 99.9%. Ladies, let's protect the most precious jewel in the world, you.
Rain Premium Sanitary Napkins do not make any medically backed claims or personal recommendations of any kind. For more information, contact Marilyn McGee.
Welcome back to Couch Convo with Coach Karla. Thank you so much for joining us. I am joined by some very special guests. On tonight, we have Dr. Ima Ahanke. She is an HIV expert and researcher. And we also have Michelle Seymour, who is a men's health ambassador with the Cutting Out Stigma program. And so for people who might just now be joining us, Dr. Ima, can you give them like a brief explanation of the Cutting Out Stigma program?
Sure, definitely. So the Cutting Out Stigma program is an initiative where we have trained barbers in Memphis and in Nashville to be men's health ambassadors working in the barbershop to promote men's health, men's sexual health, and to reduce HIV stigma. And we're doing this really to combat a challenge that we're seeing, quite a bit in Tennessee, where there's a significant burden of HIV. So this is a great model, and we're really excited. We're piloting it over 6 months in Memphis and Nashville, and we're hoping to see positive impacts on men's health.
Yeah. And so for people who are just joining us, Michelle Seymour is actually I still say beautician. Do y'all say beautician? Okay. All right. Good. I'm not too far behind.
No.
So, I'm finding out that I have to continue to learn today's words. It's just this continual thing. So, yeah.
Yes.
All right. So, Michelle, you mentioned that your chair is warm. What other ways do you use to make people feel comfortable opening up and talking about? Do you start by getting them to talk about their health, or do you introduce them to the program? How do you do it?
Well, for one, the print media, like the posters and whatnot that we have displayed through the shop, that's one thing because we have a lot of artwork, and putting those posters up was like, oh, what's the addition? And so that sparked a lot of conversation and questions. And then another thing is the Crazy About Hair, the salon I work in, is beauty and barber. So we're able to piggyback off of each other. And it's easy to do that because being male and female energies, conversations come up sometimes. And so it's easy for us to piggyback off of each other, and then just throw a zinger in there to kind of help, take it from fun to a little bit deeper, and dig into some things that are important.
Okay, good. And Dr. Ima, beyond this program, what broader changes do you think need to happen in healthcare and public health to reduce disparities in HIV rates among racial minorities in the United States?
Wow, that's a big question. So I think, this program, as we've mentioned, is focused on HIV stigma, but I think there are a lot of potential further applications because, like Michelle said, sometimes they're referring people to resources. So someone who's never heard about HIV prevention or pre-exposure prophylaxis or PrEP, maybe now they know about it, they know they have a resource and they can be linked to PrEP. But I think what we really need to do is be pretty unapologetic about saying what are the communities where this disease is really disproportionately impacting, and how can we make sure that those communities get treatment and prevention in a way that is acceptable to those communities. And we just have to do it. It's not really rocket science. It's having the creativity, it's having the political will, and having the financial support to do it. And all of those things are possible.
Okay. Now you said some big words. You said pre-exposure prophylactics
Yes.
and prep. Now I've heard prep a lot on different commercials, but is it okay if you explain to people what pre-exposure prophylactics
I
is?
would love to.
Okay.
So pre-exposure prophylaxis. So pre is before. So before you get exposed to HIV, you have a way to prophylax or prevent from getting it.
Okay.
And
Yes.
so pre-exposure prophylaxis shortens to PrEP. So that's PrEP. It's the prevention.
Okay.
And so the most common way that PrEP is given is by a pill, and a pill that you can take once a day. But there's also injectable versions of PrEP. And there are more and more coming out that are kind of longer and longer acting. So right now there's an injectable that you could get once every 2 months. Soon it will be every 6 months that you can get. But the whole point of this is that, let's say you are in a relationship with somebody who has HIV, you could take PrEP to prevent you from getting it. Or let's say you're in a community where there's a lot of HIV, and you are having sex, you don't always know people's HIV status, you could take PrEP to prevent it. So a lot of people don't realize that they may be eligible for PrEP. You don't have to take it forever. There may be a time in your life where this is a good thing to do. A lot of people don't realize they're eligible for it. And what saddens me the most is when I see someone come to HIV clinic and now they have HIV and they tried to get PrEP and nobody gave it to them. So I really want people to be aware of PrEP because if they're eligible for it, if they think they're eligible for it, then they probably should take it.
Okay.
It's harmless. It's really low side effects, low toxicity, and it could prevent you from getting HIV. It works really well, more than 95% efficacy to prevent someone getting an HIV infection.
So, as you were talking, with us having high rates of HIV in Shelby County,
Yes.
do all of us need PrEP?
Very good question. So, for someone to get HIV or a sexually transmitted infection, let's say any sexually transmitted infection, it's a combination of what's the community you're living in, who you're sleeping with, and how many people you're sleeping with. So it doesn't mean that, if you're not having sex with anyone, obviously you don't need PrEP.
Right.
For sexually transmitted infection. But if you are in a community where there's a lot of sexually transmitted infections, and we've talked about HIV, but Memphis also have really high rates of other sexually transmitted infections.
Yeah.
Then, just having, normal encounters could put you at risk. So that's why I tell people to ask their provider, am I eligible for PrEP? Can I get PrEP? And being able to refer people to resources for PrEP in Shelby County is really important.
Okay.
Yeah.
All right.
So ask about PrEP. Ask your provider about PrEP.
And I've been trying to think about what's the best way to ask you this, but how effective is wearing a condom in preventing HIV?
It is effective,
Mm-hmm.
but just like pregnancy, if you don't wear a condom, it's not going to work.
Mm-hmm.
And so PrEP, I would never advise people not to wear a condom, right? Because even if we're talking about PrEP preventing HIV,
Mm-hmm.
if you're not wearing a condom, you're still at risk for syphilis and gonorrhea and
Mm-hmm.
chlamydia and all the other things.
Mm-hmm.
But PrEP is a tool that when it's taken right, it
Mm-hmm.
works really well. Probably a bit more effective than condom use. But the ideal situation, if you're trying to protect yourself out here,
Mm-hmm.
is to use a condom for sexually transmitted infections, PrEP for HIV,
Mm-hmm.
and there are lots of PrEP resources around the city.
Okay.
Many of them are free.
Right.
So we want people to know about them and be able to ask about them.
Okay, now here we go.
Yes.
So, what I know as a therapist and a member of the community is that people aren't wearing condoms. How do we empower women to ask men to wear a condom? That's the best way that I know to ask right now.
Yeah, that can be really challenging. I mean, there are it starts young, right? I mean, it starts with talking with children, young ladies, young men, very young as they're debuting into their sexuality about negotiation and what saying no looks like and what negotiating for yourself looks like, because you can't have the first time you're trying to figure this out is when you're in that hot seat of a situation. So a lot of that is kind of backing it on up and talking to kids when they're younger and they're first starting to learn these things and have these conversations, and saying that it's okay to demand this of a partner, because we don't socialize our girls to say it's okay to say no, actually I don't want to do that, or we
Right.
have to do it this way,
Right.
or here's a female condom and this is how it's going to go down for me.
Mm-hmm.
So I think we have to start a lot earlier with those conversations.
Yeah. And not depending on them to be prepared as well. Be prepared yourself.
Mm-hmm.
If they don't have what it is that you need to use the condoms or anything of that sort, then have them as well if that's the type of exploration that you're doing.
So, and what Michelle, I want to make sure people hear that she's mentioning a female condom because those do exist. They are out there. I've seen them at Walgreens. Okay.
Yes.
So, and I should have said at drugstores. So, I think, are they more expensive? Are the female condoms more? I think they
You know
are.
what? I haven't actually even compared them.
Okay.
But even if you're not using those, if you're more familiar with the male condoms, we're giving them out. There are so many free resources to have them. The clinics, purchasing them, whatever is gonna be the most comfortable method, but being ahead of the game and being prepared yourself if you're gonna suggest it, because you suggesting it and them not being comfortable, being unaware, being against it, if you have it yourself, at least then there is no backing out because due to being not prepared.
And I want to interject this. This is actually something that's been bothering me. Um, for our young women, and I mean middle school, junior high, high school, and adult women,
Yes.
it is easier, and this is just my opinion and common sense, it is easier to have that conversation about protection if you are in a relationship with a person, as opposed to a lot of the one night stands that I'm hearing about. And so that I just wanted to say that. And either one of you want to comment on that?
Well, it's the foundation for a bond, so it makes the conversation easier because this is someone you know, and obviously, if this is the step that's being taken, someone you trust, versus someone that you're involving yourself with frivolous activity. So that the bond is very important, and the boldness to speak.
Okay. Right.
Yeah. No, I agree. I think that, I mean, it's definitely easier if you're in a trusted relationship already, but I think the skill of negotiation for women and their bodies is something that we cannot take seriously enough. And so yeah, I think it's easier to negotiate in the context of a hopefully mutually respectful and loving relationship.
Yeah.
But even in those cases, people aren't always comfortable. So
Yeah.
yeah.
Right. Thank you so much. And I want everybody to know that I'm not normally this shy about this topic, especially in session, but I'm on TV now, so it's a little different. It's a little different. Um, has there been any feedback that you've received from um Memphis and Nashville from the communities, like community leaders about the program?
So definitely, I mean, we've partnered with Tennessee Department of Health, Shelby County Health Department, Planned Parenthood, several community organizations, Connect to Protect here in Memphis, who have all been really supportive partners. Many of them were involved in the trainings that we held in Memphis and in Nashville. And I think people have been really excited and want to see, okay, what does it look like at the end of the 6 months? Like, how did it go? In the beginning, it was like, are barbers going to be into this? Are they going to be willing to do it? And so it's just been a really positive experience overall, I think, with a lot of excitement. I think barbers like Michelle and beauticians like Michelle have been like, this is unlocking an additional purpose and how I can impact my community, which is really exciting to see. So it's been really positive.
That's good.
Yeah.
Okay. And also, um, if there are other communities that want a program like this, or if other barbershops want to participate, how would they get involved?
Well, they can go to our website, cuttingoutstigma.com. They could go to our Instagram, Cutting Out Stigma, and message us there, and we can talk about how to get involved.
Have you, okay, okay. Well, I guess you're focusing on the men as opposed to women, or are you looking at in the future doing beauty shops and talking to women?
Yes, yes, and yes.
Okay.
We don't want to leave women out. We started this conversation with men because we were looking at the data of who wasn't getting into care. And not that women aren't getting into care, but men were disproportionately not getting into care. So we started there.
Okay.
But, it we don't want Black women to be left out of this. Like half of the new infections of HIV in the country are among Black women.
Yeah.
So we definitely don't want Black women to be left out of this effort.
Okay.
Yeah.
All right. Michelle, what would you share as like your biggest takeaway from the Cutting Out Stigma program?
My biggest takeaway um, is intentional efforts. Looking for ways to truly connect with people, and being intentional about the message that you're putting out and how to reach people, because of course it's already an awkward conversation, or it can be, so knowing how to approach people, the ways to initiate the conversations, to reach them, and to not be offensive, but to be inclusive, and welcoming to any questions anyone might have, to be informative. And like I said, that's given me a big takeaway just in life, period. Not just, of course, we're working towards a common goal in the moment, but that's given me, some life skills beyond just this program.
Good. That sounds really good. I was thinking, I hope that I'm thinking about the election results and the election that we just had. I'm hoping that we're all inspired to get more involved in our community. I think it's going to take a lot more community involvement and leadership from different people in the community in order to get the type of work done that we need to get done. And I want to confess that, one of the things that I said before the election was that it's up to people to educate themselves. But now that I have seen the results, I feel totally different. And I feel that it's incumbent upon me to make sure that I am educating people in my community about their rights, as well as health, and making sure that we're having health equity. So I just wanted to make sure I said that. Dr. Ima, how else can people get in contact with you and learn more about the Cutting Out Stigma program?
So I'm on social media. I mentioned our Cutting Out Stigma pages. You can find me on Instagram, Dr. Ima, on LinkedIn, Ima Hunkai. So find me on social media, message me, I will respond. But we would love to get more people involved in this initiative. And to your point, there's a lot of uncertainty, after the selection. And I think, as you said, that taking responsibility for the health needs of our community is something that I take on as a heavy and significant responsibility.
Yeah.
But we need each other. We need each other more than ever, I think, to make sure that we don't lose what we have, that we don't lose gains in health outcomes. We have so much more to do, and we need to work together to do it, for sure.
One more question. Do you feel like what you do is a calling?
Yes.
Okay, good.
Easy. Yes.
Okay. All right. Well, thank both of you all for joining us on tonight. Michelle Seymour, owner of Risque Hair, as well as Dr. Ima Ahanke, Harvard graduate, Johns Hopkins graduate, and leading researcher on HIV prevention and the leader of the Cutting Out Stigma program. Thank you all so much. Continue to join us and watch us on Friday nights on Xfinity Channel 17 at 7 p.m. Good night.
Night.